So on my latest video, one of the commenters asked what I thought about the comparisons between circumcision, appendectomies, and tonsillectomies. And as I started to reply to him, I wrote a couple paragraphs, and I kind of have a rule that if I start making long comments where there's a lot to say, that I would rather post it as a video. It's just kind of a cost benefit analysis. If I spend a lot of time, if I spend as much time writing a comment as I would in a video, realizing that very few people are going to read the comment, but a larger group of people are going to see a video, it just kind of makes sense to make a video. And I did actually put replies there, but it's a fascinating topic and one that actually comes up in ethical discussions of circumcision quite a bit. So I do think it's actually a valuable thing to have a dedicated video to. So um, for those who aren't aware, although I think most people are, um, appendectomies, and so the removal of the appendix, and tonsillectomies, the removal of the tonsils, are fairly common medical procedures. They're still fairly common. They used to be a lot more common. And people will kind of draw parallels between them and circumcision. And indeed, there are several parallels between these procedures and circumcision. And some of those parallels like make a difference ethically, and some of them don't. So uh, I think the first thing to point out is that uh, all of them all of them are similar in at least two ways. So all of them could hypothetically be justified, right? There are certain cases where circumcision might be medically necessary. It's very rare. Most of the problems that you can have with a foreskin can be treated in far less invasive ways. So UTIs, for instance, can be treated with antibiotics. Phimosis, aside from also being vastly over diagnosed, especially in the United States, can be treated with when it's actually a problem, because there's many men who have phimosis and don't have a problem with it, but if they do, there are other things you can do: graduated discs, stretching techniques, less invasive surgeries, uh, and whatnot. Uh, so, if we're talking about protection from HIV, using a condom, not being gay. I mean, there's more, or HPV. There's vaccines for HPV that are much more effective at lowering the rates of HPV and cervical cancer than circumcision. In fact, there's very little evidence that circumcision really reduces those. So it's kind of, just because there's a potential problem with your foreskin or the penis doesn't mean you automatically should assume that you should circumcise it. However, there are certain times when it might not only be a viable option, but the best option. Now, it's very rare, far less than 1%, probably like every few thousand. However, it could hypothetically be necessary. And it's also true that tonsillectomies sometimes might be the best choice for people. I remember getting in a debate with a pro-circumcision person once, and I brought up this parallel, and he said no. He had apparently really huge problems with his tonsils. They were getting repeatedly infected, repeatedly diseased, and they were removed, and like it was debilitating. And I can understand that. For those of you who look back, when I first moved to New Hampshire in 2014, I got mono, and part of that included a really horrible infection of my tonsils. They completely swelled shut, and I couldn't swallow or drink or anything, and it was probably the sickest that I've ever been. Um, and if it had been 30 or 40 years ago, there's a very good chance that my doctor would have recommended and performed a tonsillectomy. As it happened, they just gave me antibiotics and everything was fine, and I still have my tonsils. But even so, there probably are times when a tonsillectomy is justified, and the same with an appendectomy. There are probably times when getting your appendix removed is a viable medical necessity, or at least maybe, if not a necessity, the best option. So the three of them have that in common. They also have the other thing that they have in common is that they are or were vastly overprescribed. This is still true with circumcision. Basically, people are still there's this very vague medical recommendation that it should be done. They quote, the benefits outweigh the costs. Now, this standard is not anything close even to a medical necessity. There seems to be this, the amount of, the degree that it's encouraged kind of implies that it's medically necessary. But if you look at the actual, even the strongest proponents can't really argue that it's medically necessary. They can just say, here are some benefits that we list, and we think that these benefits are really good, and that the benefits outweigh the costs, although they usually will not list or even try and quantify the costs. Uh, but uh, Suffice to say, prescribing circumcision for people who are healthy, who don't have any problems, is vastly over diagnosing it, and well, diagnosing it. Like having a foreskin is not a diagnosis, but prescribing circumcision. Likewise, getting an infection in your tonsils once, or having some appendix problems now and then, doesn't necessarily mean that you need to have those organs removed. Um, Another thing that makes them really similar is that the penchant for surgically removing them dates back to an earlier time of medical history where there was greater medical ignorance than there is today. And there's still medical ignorance today. There's a lot of things that we don't understand very well or at all. And it's very likely that many of the medical practices that uh, are common today or happen today are going to be understood to be not necessarily the best idea in the future at some point. It could be in a year, it could be in 10 years, whatnot. So, uh, in the case of circumcision, append, uh, appendectomies, and tonsillectomies, um, all three of those organs kind of suffered from a problem where their function was not understood. Um, People, and I remember growing up always being told that um, the appendix had no purpose. I remember being told repeatedly, like in school, that it was a vestigial organ, that they think that they didn't know what it was for, and that it was probably related to cavemen, and it was for when we ate raw meat or something. I don't know how, to what degree that was the medical orthodoxy, but it is basically the case that we just did not know what it was for. It was just this part of the body that most of the time was fine, but sometimes it gave people problems, and sometimes very serious problems. And since there wasn't any known function, there didn't seem to be any negative costs associated with removing it. You know, if you have something that's truly vestigial, that has no purpose or no function, then as long as the risks of taking it out are not very high, then there's really no downside. And so why not just take it off? If you have any problem at all, remove the foreskin, or sorry, the appendix or foreskin. And it's kind of interesting because I first read an article about the value, the purpose of the appendix right around when I caught mono. I don't know if that's when they discovered it. I think they probably discovered it 10, 15 years ago. But basically, the appendix is a reservoir of gut bacteria. So let's say you get dysentery, you get really sick, and you empty your bowels, you empty your intestine, and you're completely empty of any food. And you survive, you start to eat again, and your gut bio is gone. All the bacteria that helps you digest and process food has been evacuated, and you start eating again. And the fact that you lack that biome is going to actually greatly impair your ability to get much nutrition out of that food. And the appendix acted as a reservoir. You would release everything, but your appendix would still have the necessary bacteria that could then recolonize your intestinal tract. Great, that's something that's not a bad thing to have, and there might be cases where it's necessary to remove it because it is giving you sufficient problems. But all things being equal, it should be left in unless it's a very serious case. Similar with the tonsils, tonsils protect against infection among other functions. And I don't know exactly the timeline, but if you go back to like the 50s, tonsillectomies were just handing them out. And I know both of my parents got tonsillectomies, and that if I had gotten sick like I did with mono, with inflamed, infected tonsils, that there's a very good chance that if it had been an earlier decade, that I would have had them removed. And this actually was discussed with my doctor when it happened. And he said, yeah, well, totally, those would have been cut out. We would have removed them if this was 30, 40 years ago. He goes, but we would not do that now. We know that like they have a function, and all things being equal, we would like you to keep them. And so we're not going to cut them out, even though they were horribly infected and they were actually preventing me. I couldn't eat, I couldn't drink, couldn't even swallow my own saliva. It was really bad. And but they said, no, we want you to keep them because they do serve a function. You will be more susceptible to disease and infection without them than you will with them. And I'm glad they did, because I never had inflamed tonsils again after that. Now, foreskin's a little bit more nuanced, because if you go back, you can find people who did understand some of its functions and some of its value going way back, even into antiquity, uh, and even and in the Middle Ages and in the Renaissance. So we can have uh, people like I'm pretty sure Aristotle, some of the other Greeks and the Romans, they certainly valued foreskin and they thought circumcision was barbaric and strange, um, at the very least for aesthetic reasons. But you have people like Maimonides saying, look, the point of the foreskin is to protect the glands and also to enhance the pleasure of sex, to make it more sensitive and more erogenous, and that there's nothing wrong with it, that it has that function, and that there's this fundamental functional aspect of the foreskin that's just so alien to men who are cut and women who are only accustomed to cut men, but then taken for granted by men who are uncut and intact and their female partners, is that when it's not like the foreskin is just a cap that is removed from the glands when you get sexually active and then put back on. I've had people describe it that way. During sexual action, the foreskin is repeatedly gliding on and off the head of the penis with every thrust. If you're jerking yourself or fucking your partner, the foreskin is going on and off the head with every single thrust. And this is going to greatly increase this sensation, because you're not just feeling the friction on the glands, although you will feel that even more than you would, since the glands will be considerably more sensitive. But you also have this really erogenous band of elastic tissue surrounding your penis, which is going on and off, and also rubbing up against very erogenous tissue within the vulva and the vagina. So this was kind of understood. There's for much of history, but during the 19th century, a lot of that wisdom was either not conveyed or lost, or was swamped in a demonization effort. And so you started to get people saying that it didn't really have a function. And this was hotly debated in England, but eventually we got to the point in the United States where so many men had been circumcised, and medical literature, it's actually quite interesting. But like medical textbooks, it's not all of them, but it's something like 80% of medical textbooks in the United States, whenever they depict a penis, they only depict a cut, and they don't talk about circumcision or foreskin, except to the extent that they say foreskin should be cut off, and the only point of foreskin is to be circumcised, and that the actual functions of foreskin are just apparently thought to be unknown, or a mystery, or that it's vestigial. And you get this a lot. People say it's this vestigial thing. Oh, we used to be these naked creatures running around, and you didn't want your you didn't want your glands to get caught in a twig or a thorn, so you had a sheath of skin kind of protecting it. But now that we have clothing, that's not necessary. And of course, this is just totally ridiculous. Like, as if the people who invented clothing, the people who make clothing now, are not trying to make a facsimile of your inner foreskin or your frontal band. They're just making clothing to cover you. And the cloth is not in any way analogous to the soft mucosal membrane that makes up the inner foreskin. So it's totally not the same. But yeah, I've had Jewish doctors, practicing doctors, who are saying circumcision's awesome, everyone should be circumcised, it's definitely better. And then when you say, well, what is the function of the foreskin? They don't know. They say, I don't know, it's a mystery. They think that it has no known value. And I think there's a lot about foreskins we don't know, because so much of the medical research in the world is done in the United States. And some ridiculous percentage of studies done almost on anything, but in terms of in medical procedures, is done in the United States. And it just so happens that the United States has been a very high percentage circumcised culture for about 100 years. It's starting to change now, but look, I mean, the cohorts of more intact generations are under 20 now, so they're not doing medical studies at this point. They're not really being represented I mean, they're right now the oldest cohort of more intact American males are like just starting medical school right now, or even undergraduate school. So we're still some time away before this wave starts to kind of have more general cultural effects. But there's pheromone receptors in foreskin. Why? That's a very interesting question. We know that they're there. They've been discovered from from autopsies or from examinations. So they have pheromone receptors. It's almost like a nose. We don't know what the function of that is, or how it works, or what its role in sex is. I think if Americans had been uncut this entire time, there's a good chance that this would have been researched in greater detail, but it hasn't. And then when this research is conducted by intact cultures, a lot of Americans will just dismiss it and be like, anything that shows that foreskin is sensitive or has a purpose is just the cultural bias of anti-circumcision, Europeans. And so we can discount it. And the idea that then there's some cultural bias in favor of circumcision totally, doesn't occur to them. So, um, you know, in a way, you don't want to criticize too much. Look, again, and I talked about this in one of my previous videos. In the 19th century, before the 1880s and 1890s, there was no germ theory of medicine. People had all these other theories, that it was from humors, that it was from the neurological theory of disease, right? That the fact that you would get stimulation in one part of the body would cause problems in another part. That's why a lot of people started to think masturbation was a problem, because you're stimulating your penis, and then that's going to drive you insane or give you some other issue or whatever else. Or the idea that filth or dirt causes disease. This is what people thought, and they didn't have antibiotics, they didn't have chemotherapy, they had some forms of vaccination which they did not understand how or why that worked. It just kind of been discovered that it did, and so you had that, and then you had this prophylactic revolution where they realized, hey, if we do surgery with clean instruments that have been sanitized, there's a much lower risk to the patient. Getting surgery prior to that was one of the most risky things you could do. And so you had this thing where surgery kind of became the catch-all. It was the only treatment they had to offer. And there's plenty of problems you can have where surgery is a good option. Even today, we would say that for certain things. But there's plenty of other ailments where surgery is not going to really render the best results. Cancer is one of these. Sometimes surgery is helpful for cancer, and sometimes surgery is not that helpful, and sometimes even positively harmful. I mean, you can have somebody, say, with breast cancer, and you can go and put them through a procedure where you eliminate, tons of tissue. And some of these doctors would go, if you ever read History on Cancer, it's quite terrible. I mean, but they would go and they kind of try and outdo themselves in how much they could cut away, not just the breast, but the pectoral muscles and the triceps and the biceps, and as much as they possibly can. And then there was still a really good chance that tumors would metastasize and show up in other parts of the body, and the patient would still die. They would just be horribly mutilated for the last year or two of their life or whatever. If you go way back, the Greek physician Galen would say, yeah, you can cut off a tumor, but it's usually not a good idea, because they're just going to spread whether or not you cut it off, and you've just subjected somebody to a really horrendous procedure, and that's going to not necessarily help them at all. Now, it's true that in some situations surgery does have a role in cancer treatment, but it's a more limited role than it was in 1890. So the main book that I've read on this is titled The Surgical Temptation, and you can understand this was the only kind of effective treatment that they had. So if you had any kind of problem with your penis, or even a perceived problem with your penis, or you're masturbating too much, or you had phimosis because you couldn't retract your foreskin when you were 10, they would say, well, we don't really have any other type of medical advice. I mean, they did give some advice that wasn't always bad. Say, work out more, get some fresh air, eat a better diet. Stuff that is actually probably not necessarily bad advice, but also not going to cure you of syphilis. And the same with your appendix or your tonsils. They didn't understand germs, but if your tonsils are swelling and infected and it's giving you problems, like, well, what else are you going to do? Of course, they're going to cut them out. Now, later, when you get antibiotics, you understand that, well, the surgery is, there might be times where it's still necessary, but it's going to be far less than normal. So they're similar in that way, that they were popularized as a medical procedure at a time when our medical knowledge was much more limited than it is now, and surgery was kind of the go-to option for just about every ailment. And what's interesting though is all of them, but especially circumcision, gained a non-medical cultural significance. Now, there's actually some studies that show that there's a really high correlation between people getting circumcised and getting tonsillectomies in particular, and that this is true in England, where basically it was viewed for a couple of decades anyway, and it was always contentious. There are always doctors and medical parts of the medical establishment in the UK who were intact males and who did not necessarily think that circumcision was a good option for most people. But then there was always, well, not always, but for several decades, there was also a very vocal portion of the medical establishment who thought that it was. And then it became kind of a cultural status. Oh, this is going to make you want to get this done because your son will be cleaner and he'll be healthier and he'll be more vigorous and he'll be more masculine and he won't masturbate so much and he won't be effeminate and blah, blah, blah. And then it kind of became, hey, all the other people who go to Eton and go to these other private schools, that they are, those boys are going to be circumcised, and you don't want your boy to be the dirty, commoner who has his uncut English foreskin. You want to have a nice, sophisticated, circumcised son, and so it became like a cultural fad or sign of wealth or status. Which, if you go way back in ancient, the earliest records we have of circumcision from ancient Egypt, among the priestly class, part of I mean, they had ostensible religious reasons for doing it, but then they also kind of admitted that, hey, it was a sign of status and of class. Oh, you don't have your foreskin, you're a special person. And I don't know that this was ever the case with appendectomies, but this also became true with tonsillectomies. Oh, if you want to be a progressive parent and you want to protect your child and you want to show how far thinking you are and prophylactic you are, and there's this big emphasis on cleanliness, which is not all bad, but you can take it too far if you say, in order to achieve cleanliness, we are going to excise any part of your body that can be dirty, which, by the way, any part of your body can be dirty, right? You will be cleaner if you cut off your ears and your nose and your finger, right? You get dirt on your fingernails, you get dirt in your ear. Well, if you remove those, then they will be gone, and so will be any dirt that you can get there. And also, you will never get an infection in those areas, right? If people get in a huff about comparing female and male circumcision, but if we remove a woman's vulva, if we remove her clitoris and her clitoral hood and her labia majora and her labia minora, whatever else you can say, those tissues will never get an infection. They will never become the home of a cancer, and they will never harbor any other dirt, grime, or other things. And so these are, when we come to circumcision, these are considered like big benefits. So you could easily say, well, whatever else, that's a big benefit. And there's a kernel of truth to that, because it is true. Once you remove those tissues will not harbor any dirt and they will not harbor any pathogens. Now, there's a cost benefit analysis there, like, well, what are the odds that they're going to harbor something bad, and that something bad is something that can't be treated, and don't these structures have a purpose that is themselves, has some value to the person? And what our society has said is, well, for women, the answer to that is yes, that those tissues are valuable to her, and for a man, the answer is no. And again, the AAP, so this is, and I come back to them, the American Academy of Pediatrics, their view on circumcision has kind of been not necessarily a barometer, but kind of the only official, and it's not a government organization, but the only like medical association that really talks about it in detail. Uh, you know, they will say things like, for circumcision does not harm the penis itself, as if the foreskin was not part of the penis. And when they say the costs outweigh the benefits, or the benefits outweigh the costs, they'll go to great lengths to try and list the benefits and then exaggerate the benefits, and most of the benefits are contestable. But even for the sake of argument, let's just say that every benefit they list is valid and just as valuable as they say that it is. But then the cost, they don't know. Aside from little things like they don't know what the rate of complication are, or they don't know what the long-term effects of the trauma of the surgery are. They don't, like, these are all things that are real effects. They just don't know what they are. They say in the report in 2012, which is their latest statement on the topic, that that they don't know what those are. But then they don't say what the function of the foreskin is. It doesn't have any purpose, and it's just lost. Let's assume you have a perfect surgery and there is no complication, and but you're still missing your foreskin. That's a loss. That means something. And what will always happen in debates like this is then you will have lots of men who are circumcised at birth who will come out and say, well, it didn't mean anything because I don't place any value on a foreskin. Yeah, you don't place any value on it because you don't have one, and you never did. Um, so there's been, I think one of the differences is that appendectomies and tonsillectomies don't quite have the cultural significance that circumcision does. Circum and you know this because there aren't ritual tonsillectomies and ritual appendectomies. They're never. We don't know of any cultures that, Egyptian priests would go and get their tonsils removed and be like, "Ha, look at me! I'm a, I'm chosen of Pharaoh or whatever because I don't have my tonsils." But they would with their penis. And you get this a lot in all the other cultures that practice circumcision. And generally, circumcision is practiced as a rite of passage done to adolescents, older children, or whatever. And it's associated with becoming a man versus being a boy. And it's a powerful ritualistic episode. You have the ritual itself can be powerful, and then you have this physical mark that just fundamentally changes your sexuality. Every time you orgasm will be different. Every time you have sex will be different. Every time you look at yourself, it'll be different, and different in a fairly profound fundamental way. Um, and I mean, there's a common citation out there of an African doctor from a pro-circumcision culture saying, well, I favor circumcision, but you want to do it to like someone who's old enough to understand the significance of the procedure and who can understand, yes, this is painful and yes, this hurts, but there's a good reason for that. I'm going through the trial to become a man, and so the pain has a function. And people can really cope with a lot of trauma and pain if there's a good reason for it. A pro football player goes through an enormous amount of pain and trauma, but aside from the financial incentive to do so, they have a reason to do it. Same thing with like an MMA fighter or a person, just anyone pursuing any kind of activity that they value, but that entails a physical cost. People who hike a lot and they get blisters and they get tired and they get sweaty and they get, bumps and bruises and scrapes. They still want to do it. And inflicting that stuff on somebody who doesn't want them would be considered torture, but someone voluntarily doing them because they value the outcome, they can really cope with that better. But a newborn baby does not have any of that. A newborn baby does not know that it's Jewish. It doesn't see itself as has no understanding of its role in the cosmic, in this multi-thousand-year culture. It just feels excruciating pain that it can do nothing about, that it can only struggle and cry and then go into a comatose state. And that's it. It doesn't know that it's doing this for the greater good. So I have no problem if an adult says, "Hey, I'm a Jew and I want to be circumcised because I take my faith seriously, or my culture seriously," as the case with most Jews, and I want to get this done so that I can. Okay, I respect that. That makes sense. A newborn baby doesn't know that, and you're just inflicting this really. I mean, it's quite. They're doing it without anesthetic, or at least always with no general anesthetic, and it's going to be painful as fuck. Um, like the closest analogy would be like peeling your fingernails off you. It would be torture. I mean, the cortisol levels that they measured in babies when they do it are indicative of it being torture. So, which makes sense. You're taking like a very sensitive part of the body and ripping it apart and crushing it and tearing it to pieces. I just saw an interesting video where they just had groups of normal people and they interviewed them about how they felt about circumcision, and they were all in favor of circumcision. And then they made them watch one video of a circumcision, and all of them changed their opinion. Some of them said they would never do it. Others said they would still do it, but they were very now on the fence and very concerned about it. So there's something viscerally about it that strikes people the wrong way when they watch it, which is why hospitals don't allow people to witness them typically. So, but yeah, one of the main differences is that it has this cultural significance, that it has this, people, and it's funny because you have all these people who are vehemently in favor of it, who argue for it, but then they say, oh, it doesn't really make a big deal. It's not a big deal. It doesn't really have any effect, but then they really, really, really want it to happen. There's a very interesting disconnect there. If it's so trivial, if it doesn't matter so much, then why be an advocate for it? Why is it so important that it needs to be done? Um, and I think that it's cultural and psychological, right? When people, I mean, it's one of the oldest things that we know about psychology. If you traumatize somebody as a child, especially, there's a very good chance that they are going to inflict similar traumas on others. And so there's this phenomenon called the adamant father, where mom and dad are debating whether they get their son circumcised, and the mom is not finding any of the evidence persuasive because there isn't really any strong persuasive evidence in favor of it. And the father will be like, no, he's getting circumcised. They don't care. Like, these medical arguments, I think, are almost all red herrings. These are not the motivation for the vast majority of people who are getting them done. Very few people are looking at the tables and being like, yeah, we don't want our son to give cervical cancer to his potential sexual partner. We don't want him to go to Uganda and catch AIDS from a hooker. So we're going to get him circumcised. No, it's dad circumcised. The mom's dad is circumcised. Her brothers are circumcised. They're circumcised as other kids. He's going to be a member of the tribe, and we're going to inflict this on him. That's what's really going on. Now, that rationalization does not sound very good, and so people are not going to say it in those terms, but it's the only thing that really makes sense. So what happened with appendectomies and tonsillectomies is medical science advanced, and we understood, hey, these procedures should not be implemented so readily. There are cases where they are, a viable medical option and maybe even the best option, and they still get done in those cases, and there's nothing wrong with that. And nobody's going to argue against medically necessary procedures. That's a standard that even the strongest intactivists would accept, I would think. And if not all of them, I certainly don't have a problem with that. But what happened with those is that once the knowledge became diffused, and there might have been delays and backlogs where you have medical practitioners who don't pick up on it right away, or just because of traditional reasons they keep doing what they've been doing for a little while, but now they've become far more rare. With circumcision, one of the common sayings is it's a cure looking for a disease. That there's been constant wave after wave after wave of purported benefits of circumcision, and whenever those are disproven or discounted or shown to be fallacious, a new one is discovered. So, initially it was a whole bunch of stuff that was completely considered laughable or completely denied today. So there was a lot of claims early on that it would protect you from syphilis, that it would protect you from a disease called spermaturia. Spermaturia is not a real disease, but basically it's stemming from the Victorian puritanical belief that any ejaculation of seminal material that is not into your wife to get her pregnant is ethically a problem and actually medically a problem. Like, if you are having nocturnal emissions, if you're jerking off and having orgasms, never mind if you're having sex with a hooker or whatever, that's actually a medical problem called spermaturia, and that foreskins cause spermaturia because foreskin feels good to play with and foreskin is sexually pleasurable. And so, two things: we remove that pleasure, and also we do the surgery in the most painful way possible so you can have a Pavlovian association of pain and suffering with your penis. We have doctors saying this, that it should be done without anesthetic, with the child awake. This would be for an older child. So when circumcision was kind of first getting popularized, it wasn't performed on neonates that often, but onto older children. That it would be teaching them a lesson. Oh, you play with your penis? You like to play with your pee-pee? Okay, well, we're going to tie you down, strap you down, and we're going to rip that fucking foreskin off. And just see how much you touch your penis after that. That was a widely expressed and accepted medical procedure when circumcision was becoming popularized. And it was very difficult to convince adult men to do this, by the way, but it wasn't so hard to convince adult men to have it done to their children. So this is something that we kind of know that most men would not voluntarily agree to, but they could subject their sons to it. Right. And eventually those ideas kind of fell out of favor, and people realized having a nocturnal emission is not a problem. Jerking off is not a problem. There might be moral or ethical problems with, sex outside of marriage or non reproductive sex, but they're not medical issues that require surgery to fix. Then there was beliefs that it would protect you from cancer, penile cancer, and like those have been shown to probably be more of a hygiene issue. If you have people who can shower occasionally, they're not going to have the problems that they might have had if they could never do so. And even in the studies that purported to show an association between foreskin and penile cancer, the association was so low. You were talking about circumcising hundreds or thousands, maybe tens of or hundreds of thousands of boys to stop one case of geriatric penile cancer. So not a strong argument to do it to everyone. Then you had claims, UTIs, as if we didn't have antibiotics for those. All right, girls get more UTIs than boys too, and no one says, well, we should just surgically alter girls to try and stop that. And other STIs, gonorrhea, chlamydia, which we know being circumcised does not protect you against them. And then the more recent one has been HIV, and I probably will do a video just on the HIV one because it's one of the more interesting and it's the more common one today. But suffice to say, studies of heterosexual men in Uganda and Kenya and South Africa. I mean, one person I read is assuming that these studies found that there was some meaningful reduction in HIV rates. That's a good reason for an adult man to decide to get circumcised. That's not a good reason to circumcise a neonate. And there are no studies that show that circumcised neonates have lower rates of HIV. There's no studies that show that. It's just these studies of these men in Africa. And again, they say, you hear this number 60%. That's a relative reduction. So you're talking about 2% of the intact men catching HIV and 1.2% of the cut men contracting HIV. So it's like less than a 1% difference, but in relative terms, it's a 60% difference. But there are other problems with that study. The men who get circumcised are obviously, because they had a surgery, are not capable of having sex for a certain period of time. But even more than that, the men who got circumcised were getting repeated visitations to medical counseling because they had had a surgery, where they would be instructed on the safe use of condoms and given condoms. And so you have one group where you're giving, remember to use a condom, here's a condom. Remember to use a condom, here's a condom. Remember to use a condom, here's a condom. And another group where you don't do that. And then the group that you are handing out condoms has a 1% decrease relative, to HIV in the other group. And you go, oh, it's because they got circumcised. Like, well, that, or because they were using condoms, maybe slightly more. They also did not determine how these people caught HIV. So, is it possible that some of the uncut men were secretly bisexual and they caught HIV from bottoming? In which case, the fact that they had a foreskin was completely irrelevant, or maybe from intravenous drug usage, or from going to a hospital and just having contaminated. These are actual big problems in Africa, and the studies did not cover any of that. But whatever, we could go into that forever. Suffice to say, there's no studies that show circumcising neonates reduces their rates of HIV. Certainly not. Look, the United States has a really high circumcision rate. We have way more circumcised males as a proportion of our population than does, say, Europe or East Asia, and yet we have a way higher HIV rate. So, where's the evidence here? It's not very good. But it's just interesting, though, why. But there's this strong desire to find it. Like the researchers who did the Africa studies were strong proponents of neonatal circumcision in the United States before they did the studies. And there's a lot of evidence that they were going to Africa to try and find a way to justify circumcision. A lot of people say, well, this is because they're motivated by money, because circumcision is a money maker. And yes, it's true. Doctors charge for circumcisions, and doctors can take the foreskin flesh. That's valuable material, and very often it's commercially used. I don't think in every case. And that's definitely a factor. That's definitely part of it. But I think it's much deeper than that. It's a cultural shibboleth. It's something that psychologically, I mean, in the case of doctors, they're kind of in this really bad situation where they can't really morally question it. If they start morally questioning it, then they could potentially be finding themselves to have committed, a massive rights violation. And, nobody wants to do that. That no one wants to admit that even to themselves. But, you have a culture that just is really, they demonize foreskin. And I think part of this is, I mean, deep down, I think a lot of it is insecurity and emasculation, that people say, hey, I'm missing part of my penis. Guys who aren't missing that part, they've got something that I don't. I mean, that's literally true. There's no way to get around that. And you can walk around and be, well, I'm cleaner, and well, it's, I can last longer, uh, which is kind of a weird, like, it doesn't affect sex, but then I can last longer. What the fuck? Does it affect sex or not? And what's the assumption, right? So there's clearly the cognitive dissonance is quite strong here. Another subscriber of mine was telling me he was talking to a friend, and he proposed, well, what about if somebody, said, well, our culture is we remove the earlobes, just the earlobes. He's like, that would be ridiculous. That would be totally wrong. I was, but cutting the foreskin is okay. I was, well, yeah, it's totally okay. What's your point? Right, so like, yeah, and there's no Meissner's corpuscles in your earlobes, by the way. They're not. Oh yeah, I'm not a Ferengi. So, like, I think that the the distinction, one of the main differences between circumcision, appendectomies, and tonsillectomies is that um, there's a strong cultural, psychological significance, right? So, like, if you get an appendectomy, you're not going to be laying around thinking, I've got an appendectomy, I'm missing my appendix, and when you go to the locker room and walk around, no one's going to be like, oh gosh, did you have an appendectomy? But they know when you're circumcised, and you know when you're circumcised, and every sexual partner knows that you're circumcised, and every time you play with your penis, or have sex, or fantasize about yourself, or whatever, um, that's part of it. And our sexual organs, for better or for worse, are a significant part of our identity. And you can argue that maybe it's too much for some people or too little for others, but that's just a fact. And when you go and surgically alter it, you're going to alter that part of their identity. And literally every time that they have sex, it's going to feel different, and it's going to be a different function. The way that it works is not the same. And that's going to have a deep, deep psychological impact. And there's another way that these are different. We don't have a movement of people going around saying that, wow, I really wish I haven't had that appendectomy. I really wish I hadn't been tonsillectomy. And we do have men who do that. Now, granted, it's a minority. Most men don't do this, just as most women who are circumcised don't complain about it and, lead campaigns against it. But there's this movement among men who do it. And it's relatively small, but I think there's really strong cultural reasons for that. A lot of men who have problems with their penises don't associate them with their circumcisions. Just again, I met a guy who had had adhesions from his circumcision all the way up until he was 18, that he had to deal with, that he did not recognize as being from circumcision. And he finally got them fixed. But, he has no animus towards circumcision. He has animus against the adhesions. Right, so he had a complication from the surgery, but he has no problem with the surgery. In fact, we haven't gotten into it too much, but when we talked, he was clearly in favor of circumcision, even though he had suffered and adhesions are maybe the most common complication, and we don't know that it could be as high as 2%. We're not sure, but I've met plenty of guys who still had adhesions, and most of them had no idea that they were a result of circumcision. They just thought that they were born funny. That they were born with it, skin adhesions. And for those of you, if you can go Google it, skin adhesions are not nice. They don't look good. They're in the way. They can be painful. And they're actually, if you're talking about cleanliness, they're not very clean either, relative to all things being equal. So another one people often bring up is cosmetic orthodontia. So people say, well, look, we allow parents to put braces in their kids, to make them, there's no religious reason for doing that, and that's not usually medically necessary. I think there are some cases with extreme problems with your dentition that, you might make the argument that their ability to eat food is impaired or whatever. And I mean, that can happen, but most use of braces is cosmetic, right? You have a big gap in your teeth and you want to close that, and so, the parent or whatever, the teeth are crooked, and there's this kind of acceptance that, well, parents can do that, so what's the difference with circumcision? Well, again, there's no movement of people that I'm aware of, correct me if I'm wrong, going and saying, hey, I really want my crooked teeth back. Two, it's not done to neonates, it's done to older children where consent is more possible. And this gets into the issue of can children consent and when and whatnot. But I would argue that there might be limitations that an 8-year-old or a 10-year-old in terms of their ability to consent relative to an adult, but they are capable of more consent than a neonate. The amount of consent a neonate can give is pretty close to zero. I mean, it can cry and it can act happy, but that's the extent that it can communicate anything, I guess. I mean, there might be more to it than that, but it's not much. You know, a 10-year-old, you can ask a 10-year-old, do you want your teeth to be crooked? And they could hypothetically say yes or no. And I think that while there might be problems with that, that's a lot more significant than the baby. Uh, and then the other thing is that there's remedy. Let's say you are not happy that you had cosmetic orthodontia when you were a kid, that you liked your teeth the way that they quote naturally were, and you want your old teeth back. Well, you can get them back. You can go to a doctor and be like, listen, I want my teeth to be crooked again, and they can put in braces and just do it the other way. It's probably never happened, but it's hypothetically possible. If you are circumcised, you do not have that option. You have some remedy. You can go and do foreskin restoration, but foreskin restoration does not make you intact, and it takes for fucking ever. So it's not comparable in that way. And again, I don't know. I mean, teeth socially they kind of matter in terms of eating. They matter. The cosmetic part, I don't know how it'd be difficult to quantify how valuable that is or isn't. Um, but there's one other point I wanted to make. Yeah, there are some, you know, this is one of those things where you can have different circumstances that share certain principles or share certain things, certain commonalities, but those commonalities don't necessarily, sometimes there's distinctions where a difference and distinctions without a difference. And you know, that's often what we're dealing with when we have these discussions. Oh yeah, so the point here, you know, there's this kind of judicial concept that if you have a party that can't consent, and sometimes this is done for like people who are dead. You know, let's say a person dies and they're intestate and they have an estate, and we don't know what they don't have a will telling us what to do. Um, you kind of have to do what you would guess would be their most favored thing to do. What would they most likely want? And the thing with circumcision is that people say, well, I was circumcised and I feel fine, therefore my son will feel fine as well. Um, yes, he will feel fine if you do the circumcision, assuming he doesn't have any complications and assuming he doesn't become an intactivist or someone who regrets it later. He won't have anything to compare it with, and you will have obliterated his any value he could place on a foreskin, at least his own personal foreskin. And so he won't know what he's missing, and so he won't have any kind of concept of the loss because it will be out of his mind. But that's not the fair comparison, right? The comparison isn't how many people who we do the surgery on will, in growing up, having been surgically altered and not knowing any better, would say that they feel okay with that. The question is how many men who are uncircumcised decide that they want to get circumcised versus how many men who are uncircumcised are happy being uncircumcised. And the ratio there is overwhelmingly in favor, even in the United States where there's so much pressure and so much stigma attached to foreskin. The vast majority of men who make it to adulthood with their foreskins keep them and are happy to keep them. And there is absolutely no reason to assume that your newborn son will not be among them. There is no reason to assume if you leave him intact that when he grows up with his foreskin that he's going to be like, God damn it, I wish I had been cut. Now, there has been kind of historically been this thing in adolescence where very commonly in the United States, in a predominantly cut culture, something that is at this point no longer really true, that they could feel some social stigma to being uncircumcised. And most of the uncut guys that I talked to did, you know, express that at some point they did feel that, you know, that they felt like, damn, you know, I stand out. Now, aside from the fact that nudity is becoming increasingly rare and people are not getting exposed to their peers nearly as frequently as they were 30 years ago or more. If they were, they would see that a larger and larger cohort of boys and men are not circumcised. And so they would not be the one guy in 100. They would be the 20 guys in 100 or the 30 guys in 100 or the 50 guys in 100, depending where you live. And I mean, there's certain places where in the United States where circumcised guys are the minority. I met a guy who was from Maine, and he said like on his football team, he was about 2/3 uncut, 1/3 cut. And the cut guys were the ones who got made fun of. The cut guys were the ones who got ridiculed for being mutilated, basically. The uncut guys are like, oh, look at you, you're missing, you don't have a hood, you don't have a foreskin, blah blah blah, right? And that's actually apparently that's fairly true in places like California, Oregon, Washington, a lot of cities, Boston. It's less true in the Midwest, but uh, you know, there's an interesting philosophical question here. If you deprive somebody of something, if you take something from somebody, and then they don't know that it was taken, or they don't have any kind of understanding of its value, and so they never come to lament the loss, is that okay? And it's difficult to find a parallel, but I could imagine it. Say you have a child who's inherited a lot of money at birth. They were willed it by their grandfather, who they don't know or whatever. And let's say they've got they inherit $1 million. But of course, as a baby, they don't have any understanding of that. They don't know that they have $1 million. They don't even know what $1 million is. And let's say that their parents decide, we're going to take 80% of that. We're going to take $800,000 of that for whatever reason, and they do. And the child grows up, and they have their $200,000, and they're happy that they have their $200,000, and they don't miss the $800,000 that they don't know that they ever had, right? That they have no memory of. That just is this abstract thing that they aren't aware of. They don't miss it, so they go through school and they do everything, and they get through life. They have a fairly normal life with the $200,000. Would you say that that person has been robbed? Would you say that that person has been wronged in the ethical sense? And I would say the answer is pretty obviously yes. Yes, because they had something that was theirs, and it was deprived from them. They just by the nature of how it was deprived from them, they just did not know it. They didn't realize, hey, that was actually, and this actually has happened with some child actors. There are cases of child actors who made tons of money, in some cases millions of dollars, but legally, and some of the laws have kind of changed here, where like the parents can't really do this anymore, but parents would just take basically everything they earned. And once they were no longer child actors, they grew up and their marketability went away. So they were kind of like these former stars when they're 18. They have no money, and their parents, run away with everything that they earned. And, they're at least cognizant of it, and they feel like they were ripped off, because indeed they were. And I think that's exactly like ripped off. In this case, cut off. I think that's the closest analogy I can think of, and I don't know of any way to excuse that other than to say that it's wrong, and that it was and that you can't say, well, he had $200,000. What's he complaining about? And he had a happy life. He still had friends and went to the playground and went to school and got a job. And what's the problem? Well, the problem is that he didn't have $200,000. He had $1 million, and you took 80% of it. And when they cut off your foreskin, they're taking 80% of your sexual sensation, of your sexual pleasure, from every time from that. And another difference would be if they when they took the $800,000, they like beat the shit out of you. Like if they went and slap. I mean, imagine if you went and slap a baby, people would be like, that is wrong. I mean, they killed the Branch Davidians because Janet Reno was told they were beating babies. But ripping the foreskin off and crushing it in a clamp, and then cutting. How is that? That's worse than beating, right? That is so much stress and so much pain that is actually brain damage. Now, presumably, you could punch a baby hard enough that you could kill it with your fists or whatever. So, it could be more physically traumatic in that sense. But yeah, it would be like stealing $800,000, 80%, and in the process beating your child up, giving them whatever trauma is inflicted then. And yeah, he won't remember the trauma, and he won't remember the money that you stole. And then maybe later he finds out and gets pissed at you, and he says, hey, get a life. So anyway, that's it for now, and I will talk to you all another day. Bye-bye.